The real problem, though, is why hospitals are going broke and why they go out of business is because we have a program in place called EMTALA that forces, and I talk about this a lot, that forces a hospital to see anyone who comes into the hospital. That's going to be your biggest problem. So what they've done is they've created this thing called emergency Medicaid. So when you go to the hospital with no insurance, and this is, we're going on a little sidebar here for all of you people who continue to see messages that you call them immigrants should not have insurance. For the life of me, you cannot freaking get it. Like, it's not like they're just going to give you insurance for the rest of your life. There are a lot of people here with no insurance who go in and they need chemotherapy. They cannot get it because they don't have status as an American citizen. So this is a fact, right? You have to understand that. There are some states who will give you some limited insurance, but it's not going to actually help you long term. This is very short term. This one emergency room stay, like, and even that, when you have to go back and they get a bill, they'll never be able to pay that. So just things to remember. But in terms of, do hospitals make more money or will Medicaid put them out of business? No. The thing that's going to put hospitals out of business, and I've continued to say this, is not people who have insurance. It's people who don't have insurance that the hospitals have to continue to see, and then you pull their government funding. That's literally what's going to do it. Like, that is 100% going to do it. And you're saying, well, Henry, well, they need to see everybody. I agree they need to see everybody, but that system only works when we have enough hospitals in place that we don't have to have as much diversion, right? I've got patients right now in Fayetteville, Georgia, who are being sent to Grady, downtown Atlanta. Well, they're not our patients, but people that call in or talk to me because there's no trauma hospital like between here and Grady, right? Like, literally, that's what's going to cause people to go out of business, not this other stuff. But insurances are put in place so that when people go there for their services, that the company will make money. They will make a profit. So let me just clear that up too. This other stuff is not true. They will make a profit. But the reality of it is, and this is what I believe is going to happen, they're going to pull your insurances. So people are going to not be able to have insurance anymore. And once you don't have insurance, you still go to the hospital because you're going to go to the hospital more now because you can't go to the doctor's office without paying out of pocket. So you're just going to go straight to the emergency room because there's no copay. So not yet. So you go straight there, you'll get stabilized, you'll go home, it'll become a revolving door. That's what's going to put hospitals out of business sooner than later. It won't take as long as you guys. People are telling me 10 years. It won't take 10 years. It may not even take 5 to 7. Like, I'm being completely honest with you because hospitals are already shutting down. So imagine going into an ER that has 200 people a day and 100 of them have no insurance, but you have to see all 200. But here's where it gets tricky. You don't know who has insurance, right? So if 100 of them come in, or if all 200, let's just say 100 come in on a stretcher and they all have emergency things that have to be taken care of, you don't know who has insurance. You have to see whoever has the most critical at that time. That's what's going to do it. That's what we have to fix. So that's why I am one who says healthcare for all. Figure this out. And if you're asking me, how do you fix it? I've been saying this for a while. You can't undo things that have been done, but this is what we can do.